As I said, today we'll talk about different sectors within healthcare, right? So first sector that we spoke about is called service providers, right? So their job is to provide um,
services, health services,
right? Health, yeah. So you call them as healthcare services and facilities. Okay. So you have healthcare. Okay, I can type it. So first sector is health care services and facilities. Okay. Second could be your medical devices, call them as equipment. Okay. And hospital supplies, right? We'll talk about it. Okay. Third, yes.
If you don't mind, can you type this on a notepad and share the screen?
That's okay. You know, this will be anyway getting recorded, right? You can refer it.
Okay.
Yeah. So then you have the third one is your medical insurance. Okay. Medical insurance and what you call as managed care. Okay. Where, you know, somebody is paying for your medical. Okay. And last you said was pharma and a lab. Okay. Pharmaceutical, right? And related like labs and things like that. So generally within this segment, okay, you will have these four kind of segments. Okay. There is a app called as McKinsey app. Okay. Mobile app. Okay, this McKinsey Insight. Okay, so I would say download this app. Okay, so when you download this app, okay, it'll ask you to enter your username, password, you know, register on it, and then you can select. Okay, this will keep track of all the latest happening in the field. Okay, so you can choose. Okay, which field you want to keep track. You want to track only healthcare, you can choose healthcare. If you track other industry, as you can choose, and then it will every day will give you articles. So maybe you know you can spend maybe half an hour or half an hour is good enough. Okay, so you know what is happening in the field. Okay, latest information you will have. Okay, so yeah, coming back to the first one, right? What is the first one?
Healthcare services.
Healthcare services, right? So here we talk about nursing homes, hospitals. Hospitals are full-fledged hospitals, right? They'll have multiple doctors. They can provide care for any kind of problems. Nursing homes are dedicated, right? They might have nursing home for a particular thing only. Okay, you have say senior care. That's dedicated only for
long-term care.
What do you call senior citizens, right? So they are very focused on a particular thing. Then you have ambulatory care. Ambulatory care are mostly your outpatients clinic. Okay, even labs fall under ambulatory care. Okay, so here ambulance services is also part of it. Your diagnostic labs, okay, part of it. Your outpatient clinics are also part of it. And then, of course, you have medical practitioners where you can, you know, who can prescribe a medicine for you. Okay. So here you can have like dentist, psychologist, right? Dermatologist, nutritionist, right? Your optometrist, right? You know, so you know, these are different segments within your medical practitioners, right? So the first one contains your medical practitioners, right? Then if we talk about the second segment, medical devices, these are again very, very important, heavily dominated by rules and regulations, right? Like, you have FDA, right? Food and Drug Administration. They will have to certify all the equipments that goes into it. Okay, so all the equipments that you see, ultrasound. These days we talk about robotic surgeries, right?
Yes.
Your X-ray machines. Okay, even your if you look at even your wheelchair falls under this. Okay, because it says medical devices, right? So even wheelchair is a medical device. A needle is a medical device. So all these things are actually uh, falls under medical devices, and every medical devices has to get approval from FDA. So FDA does a lot of other things, right? It goes into food administration as well. But for medical devices, they are classified as three categories. Okay, three categories of devices. Of course, like wheelchair falls in the third category, but still, it is a medical device. Okay. So all the manufacturing, maintenance, all those falls under this. Okay, even your bed, right? Hospital bed that you see, that is also a medical device, right? Third one, okay, which is probably the most important from IT perspective. Okay, IT is involved everywhere, even in the care, right? In hospitals, you will have to manage the IT system, right? How will the patient come, like right from patient appointment to the moving of patient data. Okay, study the patient information. So next time when patient comes, you don't have to depend on the report, right? It's all available in the system, and even in that case, there's a advanced uh, uh, systems are also used. Okay, so like say, yeah, like you go and take a X-ray, right? The X-ray is directly sent to the doctor. It's available for doctor, right? You don't have to carry your report to doctor. Doctor can actually log into your account and can see. Okay, and even managing the access, right? So doctor who prescribed your X-ray can only see the X-ray, right? So other doctors cannot see. Okay, so maybe some diseases you want to keep it secret, right? So only the doctor who is giving you care will know. Other doctor will not be able to see. Right? Some things, okay, which is general. Okay, you want everybody should have access to it, right? So so IT systems manages that. Then it went about medical devices. This everything is electronic device, right? Electronic means electronic components and programming. So of course, uh, whether it's X-ray, ultrasound, everything uses programming these days, right? So that is also an important aspect. Medical insurance. This is third important part of healthcare industry, the third segment. Okay, so here it talks about the players that provide medical insurance, right? So not only the companies that provide medical insurance, but the companies they actually facilitate in providing care. Right? They are not the insurance company. They are called as TPS, third party providers. Okay, there are some companies called as clearing houses. Okay, they actually connect the hospitals to the insurance provider. Now, there could be hundreds of medical insurance companies, right? It is not possible for a hospital to connect or to link all the insurance provider, right? So when you go to a hospital, okay, doctor, you can have insurance from any medical insurance company, right? Okay, so it's not possible to have some kind of system built with all the 150 companies. That's a new company is formed. Hospitals should focus on giving you the care, not about what is the new company. There's some company will close, some company will start. So it is not possible for them to keep track of that. So we have something called as clearing houses. The clearing houses does the back end work. Okay, so they will have connect with these medical insurance companies. They will have connect with 50, 100, whatever, and the hospital will just connect with this clearing house. Hospital doesn't need to know, okay, who is your insurance provider, okay, that company exists or not, okay, or there's a new company, how to connect to the new company. Okay, so clearing houses, okay, will take care of that. So it's not only the insurance companies, but there's companies which are in the middle helping to provide care. All those are part of this. Okay. Now, so you spoke about Medicare, Medicaid, right? You have medical patient financing. The cleaning and recycling companies, who cleans the hospital, they're also part of this. Okay. Okay. And finally, the fourth segment is the pharmaceutical, right? So, what is the job of pharmaceutical companies?
What is?
What is the job of pharmaceutical companies?
They'll
Make drugs which are
their job is to develop new drugs, right?
yes.
Life sciences, drugs. Okay. So pharmaceutical, they develop new drugs. The job is to develop new drugs. So so the stores are also part of it, right? The manufacturing company who make this also part of it. Okay.
Okay.
If you talk about drugs, you have over-the-counter drugs, OTC we call them. Okay, OTC are those drugs for which you don't need prescription. Then you have prescription drugs, right? Which cannot be sold without a valid prescription, right?
Yes.
Yeah.
Then you have generic drugs. Okay, generic drugs. Then you have
Same
lenses.
formula, but they're available at low cost.
Yes. So what happens is when a new medicine is developed, right? So the company, okay, will have patent for maximum 20 years. Okay. So for 20 years, nobody else can make that. If they make, they have to pay royalty to this main company, right?
Yes.
So if they start providing royalty, of course that will be more expensive than the main company, right? So generally people don't make for 20 years. The moment that 20 years expires, right, it becomes available. So there will be companies will start making, start copying those medicines, right? So they are called generic medicine. So generic medicine, you don't find generic for all kinds of medicine, right? Generally, old medicine, which we have been developed more than 20 years back, those generic medicines will be available. Okay, and it is of course cheaper because the company has copied, right? They didn't have to invest into the research. It's everything is there, and a chemical, it's easy, right? You know which chemical to mix how much, because the document will have all those. You just copy and you start manufacturing those medicines, right? Then your lenses, specs, lenses are all part of it. Okay. So generally, these are the things that we talk about when we talk about sectors or domains within for healthcare domain.
Yes.
Okay. Yeah.
Saura, like
Yeah.
I have a small doubt. Like the segment, the medical devices and hospital equipment supplies, and also the medical insurance. Like, how does a healthcare BA involves in this? Like, what is his role, his or her role, like in these sectors, like medical devices? How he related to that?
Correct.
What is his work?
Correct. So now let's say you have hundreds of hospitals, right? And hundreds of hospitals, definitely hundreds of patients will be requesting for insurance, right?
Yes.
And this insurance companies has to process, and the process has to be fast, isn't it? So what can you do, okay, to sorry, to process this request. So what do you think are the challenge? There could be challenges there. Okay, let's think. Okay, think that you are insurance companies. Okay, and you're getting requests from hospital to approve their plan, right? So what kind of information you need? Okay, what will you do?
First, we have to check that claim is that claim is false one or it's a genuine one. We
That
have to
is
check.
easy, correct?
We have to check with the provider.
So that is easy. You'll have an ID. You'll check the ID and name. If it is match, okay, then it is a valid patient, right? Or valid person.
What the service they provided and what the service they asked and how extend these companies the like
So how do you
that
look at the services?
like what the patient has the problem and what
Correct.
the doctor provided
So
the service.
how will you look at? So this is exactly why BAs are needed. Okay, this is a point where BAs are needed. So my question
Because
is, hold on. Listen to my question. So let's say you are the insurance provider, okay, and I'm hospital. I send you the document, okay. So if I send you the document in a Word document, okay, and my language could be different, isn't it? Okay. Now, same thing I can write in different ways. Correct?
Yeah.
So how will you understand what I am saying? Okay, first of all. Second, you'll be getting hundreds of requests every day. How do you get? If I send you an email or PDF, will you have time to read through the email PDF? Okay, I'll write 10 pages. Okay, so how will you, if you start reading 10 pages, will you ever be able to clear your backlog? Every second, every minute, let's say even if you get every minute a request, so can you read an email and decide what happens?
No.
Right?
They'll prepare a pro forma and they'll send it.
Pro forma is what? Pro forma is also they cannot come and give it to you, right? They cannot send it through the post because the approval happens immediately. Otherwise, you are waiting, right? You cannot. Hospital will not allow you to go until your approval comes. Is it right? So pro forma cannot be scanned and sent. I mean, if you scan and send, also somebody has to open the email and read it, right? So here you have something called as EDI, okay, electronic data interchange transactions. So the information that is sent from, okay, your hospital to the insurance companies, it goes through EDI, right? Now bank, you withdraw cash, right? And immediately you go and at least this is easier, okay? Immediately you go and you try to withdraw cash from same ATM or different ATM. The record there has to be updated, okay? Whether you have entered the valid ID password card and password, and whether you have got the money or not, that has to be updated in real-time basis. So that when you check from different ATM, you get the same view. If it starts updating every half an hour, every 1 hour, right? Then in half an hour you can withdraw more than what you have in your account, right? Because it takes half an hour to update. So other ATM will not know whether you have withdrawn the cash or not. So some information has to be in real time. Okay. And when hospital says submit, okay, the information has to go in a format that is understood by the machine. See, when you want to do something fast, you cannot have some person sitting and reading email. Okay. First of all, it's very expensive to hire a person to read email and click on approve. Right? it's not providing any valid or value add, right? Yes, in some cases you need doctors. So doctors will be sitting there. Okay, medical insurance companies will make doctors sit there. But doctor will not look at each and every line. Okay, something which machine cannot understand, machine cannot process, only those will go to doctors. So when you go to 10 times to a hospital, and let's say, you don't want to go right that many times, but let's say if you go multiple times, maybe most of the time, 80% of the time, your approval comes faster, okay, without any problem. Sometimes it can take time, right? It may ask you more document, or just that it takes some time. Okay, so such cases are handled by the human being, where machines cannot handle. Machine doesn't know, should I accept or reject? Then he'll send it to the doctor who is available, right? So yeah, so only the limited number of perform, as you said, a request should go to human being, right? Most of the things should be handled automatically, right? So how will the information go, right? So it has to go via what is called as EDI. So we'll talk about what EDI is, EDI transaction, okay? Then different types of coverages, different types of insurances, provider, payers, detail. Okay. So coming back to this, when the information is sent in EDI, the information cannot be, okay, now when the hospital is sending, okay, and if there is no standard, okay, I might write a disease name in one word. Somebody else might use 3 words to what do you call it, to write the same disease, right? Somebody else might use 2 words to write the same disease, right? So when the information is sent, how will machine understands whether these are same request or not, right? So what we have done is, there is a common code, we call it ICD codes, so that every treatment, every the treatment that happens has a unique code. Okay, so now when you add the code is unique, so you cannot put the code of any of your choice. So here the information is sent through code, ICD code. So you don't have to explain the problem, you don't have to tell the problem. Okay, every problem type has ICD code. So you need to find out what is the right ICD code before. If you are working with hospital, you will have to fill up these forms before sending it to the insurance companies, and this has to be correct, right? You cannot give wrong information here, because one wrong information and your approval may be rejected, right? And approval rejected means it's a problem for the hospital itself, right? You lost a patient, right? You lost money, right? So that's one, okay. And where was I? We were talking about the EDI, right? So yes, so information sending, capturing, processing, and it is sent as numbers, I told you, right? So we have to send it like a number, and that number is unique. Okay, that number is unique.
Saurav, so what will be the difference between medical transcription and this EDI codes? Will there be any difference?
Medical transaction. What is medical transaction?
Oh, medical transcription, they too write codes on the treatment.
Okay, so your medical transcription, okay, is not your medical insurance. Medical transcription means what? The doctors does not have time to write. Okay, so what they do is they will record. Let's say when doctor comes, doctor has to fill up the prescription letterhead, right? Every case has to be, when you go, doctor has to write a report, right? so and so came with, and they have few understanding, right? Okay, kind of format. So they came with so and so complaints. We'll write the list of complaint. Okay, then what you did, so what is suspected, what you did, you prescribe for a report, what happened to the report, medicine. Okay, how many days, how many tablets, what is the how many times you have to eat it per day. All those information are needed to write in the document. And some of these doctors are very busy, their time is very expensive. You don't want them to do the clerical job of writing, right? Basically. Instead, they can see one more patient, right? So, hello, you there?
Saurav.
Yes,
Yeah.
sir.
Okay. So what they do is doctors. So electronic EDI is, as I said, it's a communication between two computers. Okay. So one side, one computer is passing the information, okay, input information. Other computer will process it and again send it back. So communication. When it's a telephone line is to communicate between two human beings, right? Voice communication. Similarly, EDI is communication for sending and receiving documents. Okay, and document is not like your PDF document. Here, they will write codes and they'll send it. So going back to your transcription, medical transcriptions, these doctors will record their findings, okay, in voice. Because of course, recording is faster than writing, isn't it? So they will keep recording it, okay, and this recordings is then translated into text and written in the form. And then let's say doctor is there in the morning, okay, so doctor will record it. By evening, doctor will, the documents are ready, doctor will just go and sign on it, saying that yes, this is what I have said. So not now, but maybe I think even 10 years back or 20 years back, it used to be a big field, actually 15 years back. Okay, a lot of jobs, a lot of people just started, like they would hire even say inexperienced college medical doctors, so that it's important to understand the terminologies, right? So to understand the terminologies, they would want somebody who understands the medical terminologies, isn't it?
Yes.
And they would write it. So transcription is simply converting voice to text. Okay, now we have so many different applications, softwares that does that. So the job in the work is still happening, okay, but the people that are employed are less, because you can even use systems to do that. So EDI is different, right? Now you know the difference between EDI and transcription. Okay. So tomorrow when we meet, okay, we'll talk about first. Okay, so our syllabus is mostly on the insurance side. So we'll talk about what is health insurance, different components of health insurance, different types of coverages, that what you said, Medicare, Medicaid, and the private one. Okay, where you have public, private, and mixed kind of thing. Okay, type of insurance, provider details, etc. And then maybe second day we'll focus on the EDI transactions. Then we'll talk about different other areas. Okay, other areas of insurance, and maybe fourth day or fifth day we'll come back to agile. We'll get into little more details about agile.
Okay.
Sounds good?
Yes.
Yeah. Okay.
Yes. So we'll end it here. I'll see you tomorrow.
Okay.
Take care then.
Good night.
Bye.
Good night.
Good day.
Good.
Thank you, sir.
Thank you.